Hi guys, it's Dr. Bradley here. Today I want to talk to you about a common postural fault that a lot of patients that come to our office have. And this is forward head posture accompanied with upper cross syndrome. Basically what this means is the head has become in a forward position from the neutral position that it should be in due to poor sitting posture or injury or bad habits. And it's also accompanied by what we call upper cross syndrome. Upper cross syndrome is an internal rotation of the shoulders, a roundness of the upper back, and it's allowing that head to drop even further forward. So there are certain muscles that become short, and there are certain muscles that become long. Okay? The muscles that become short are the suboccipital muscles, the pectoralis minor, the subscapularis muscle, the sternocleidomastoid, and the scalenes. And then the muscles that become long and weak are the trapezius muscles, the rhomboids, the deep cervical flexors, the deep cervical extensors. So what we want to do when a person has these types of problems is we want to give them simple exercises they can do along with their treatment that will help to restore better posture and better alignment so that these conditions can be improved. Okay, so here we have our patient Joshua, and he is standing up against what we call a plumb line so that we can evaluate his posture. So if you look at the yellow string, it lines up with the middle of his shoulder, but if we look at the ear, you can see that the ear is forward to the plumb line. All right? In ideal posture, that string or plumb line would go right through the middle of the ear and then also line up with the middle of the shoulder. He does not exhibit a lot of upper cross syndrome, but if he were to rotate the shoulders forward, go ahead and do that, internally rotate the shoulders, now he's exhibiting an upper cross syndrome along with the forward head posture. And you can see how the upper back has rounded more, the shoulders have dropped forward and internally rotated, and you can see that this created a shortening of the pectoral muscles, particularly the pec minor, along with all the other muscles we mentioned earlier. Okay, so now we're going to go through the wall lean exercise. What we're going to do is have a patient stand up against the wall. We want to make sure that the shoulders are drawn back in a neutral position. If they were in this position, which an upper cross syndrome would look like, we want to make sure that we draw them back, retract those shoulder blades, get everything in a nice position. We want to make sure that they put their head up against the back of the head up against the wall. A lot of patients who have tight suboccipital muscles will want to look up when they touch their head against the wall. If they really have significant forward head posture, this is what they want to do. We don't want to let them do that. So draw your chin down and make sure that they're in a neutral position. Okay. Now we want to have the patient walk away from the wall with their feet, about a foot away from the wall. All right, and we want to make sure that the ear is over the shoulder. If it's not, we want to tell them to draw their chin in. All right, so I want you to just let your chin come forward a little bit. Okay, so this is kind of illustrating an improper aligned position. We want to correct this, which is the whole point of the exercise. So draw that chin back. Okay, that puts the ear over the shoulder. All right, now they will hold this position for 3 minutes. We're not going to have them do that, but this is what they would do for 3 minutes. What's happening when they do this exercise is they are strengthening, they're making the deep cervical extensor muscles hold them up. So they're strengthening the deep cervical extensors. They're also stretching the suboccipital muscles by holding this position, and then by putting them in a proper aligned position here through the shoulders, they are stretching the pectoral muscles and they are strengthening the trapezius muscles. They would hold this for 3 minutes, like I said earlier, and this is a simple exercise that they can do to help correct forward head posture and upper cross syndrome. Thanks for watching our video. We hope you found it helpful. If you did, please like and comment. Also, for more information, please go to our website, which is linked in the description. Have a great day.